Hello everyone and welcome back to a Vital Nursing 101 video. Today we are going to talk about two medications nursing students see often, gabapentin and pregabalin. Gabapentin is commonly known by the brand name Neurontin. Pregabalin is commonly known by the brand name Lyrica. These medications are often grouped together because they work in a similar way and are sometimes called gabapentinoids. Now, here is something important right from the beginning. Even though these medications may sound like pain medications, they are not opioids. They are not NSAIDs. They are not acetaminophen. They are often used for nerve pain and sometimes for seizures. So in this video, we are going to break down gabapentin and pregabalin step by step. We will talk about what they are used for, how they work, side effects, major safety warnings, nursing responsibilities, lab monitoring, patient teaching, and what findings should be reported to the provider. And throughout the video, I will add pop test questions to help you think like a nurse. Let's start with the basics. Gabapentin and pregabalin are often used for neuropathic pain. Neuropathic pain means nerve pain. This kind of pain happens when nerves are damaged, irritated, or sending abnormal pain signals. Patients may describe neuropathic pain as burning, shooting, stabbing, tingling, pins and needles, electric shocks, or numbness with pain. A simple memory tip is, gabapentin and pregabalin calm angry nerves. They do not work the same way as ibuprofen or opioids. Instead, they help calm overactive nerve signaling. Gabapentin may be used for postherpetic neuralgia, which is nerve pain that can happen after shingles. It may also be used as an adjunct medication for partial seizures. Adjunct means it is used along with other seizure medications. Gabapentin is also commonly prescribed off-label for other types of nerve pain, depending on the provider's judgment. Pregabalin is used for several nerve-related conditions, including diabetic peripheral neuropathy, postherpetic neuralgia, fibromyalgia, and as adjunct therapy for partial-onset seizures. Diabetic peripheral neuropathy is nerve damage related to diabetes. Patients may have burning, tingling, numbness, or pain in the feet and legs. Postherpetic neuralgia can happen after shingles and may feel like burning or stabbing pain in the area where the shingles rash was. Fibromyalgia is a chronic pain condition that can cause widespread pain, fatigue, and tenderness. So when you hear gabapentin or pregabalin, think nerve pain, seizures, and calming overactive nerve signals. Pop test question. Gabapentin and pregabalin are most commonly associated with treating what type of pain? A. Neuropathic pain, B. Chest pain from a heart attack, C. Pain from active bleeding, D. Pain from appendicitis. Only. The correct answer is A. Gabapentin and pregabalin are commonly used for neuropathic or nerve-related pain. Now let's talk about how these medications work. Gabapentin and pregabalin affect calcium channels in the nervous system. More specifically, they bind to a part of voltage-gated calcium channels. You do not need to make this complicated. For nursing school, think of it like this. They reduce the release of certain excitatory neurotransmitters. Neurotransmitters are chemical messengers. Excitatory means they increase activity. So if nerve signals are overactive and sending too many pain messages, gabapentin and pregabalin help turn down that activity. They do not numb the body like local anesthetics. They do not reduce inflammation like NSAIDs. They do not bind to opioid receptors like morphine or oxycodone. Instead, they help quiet abnormal nerve signaling. Memory tip. Gabapentin and pregabalin turn down nerve volume. Imagine the nerve pain signal is like loud music playing too high. These medications help turn down the volume. That is why they may help with burning, shooting, tingling, or electric-type pain. However, they do not usually work instantly. This is important for patient teaching. A patient may take one dose and say, "It did not help my nerve pain right away." That may be expected. Gabapentin and pregabalin often require time and dose adjustment to see the full effect. The provider may start with a lower dose and slowly increase it. This is called titration. Titration helps reduce side effects like dizziness and sleepiness. Pop test question. Gabapentin and pregabalin work best for nerve pain because they help do what? A. Kill bacteria. B. Calm overactive nerve signaling. C. Thin the blood. D. Lower blood sugar directly. The correct answer is B. Gabapentin and pregabalin help calm overactive nerve signals. Now let's compare gabapentin and pregabalin. Gabapentin and pregabalin are similar, but they are not exactly the same. Gabapentin is often taken multiple times per day, depending on the order and formulation. Pregabalin may also be taken multiple times per day, but it tends to have more predictable absorption in the body. Pregabalin is also a controlled substance in the United States because it has some potential for misuse and dependence. Gabapentin is not federally controlled in the same way, but some states may regulate it more closely because of misuse concerns. For nursing practice, the main point is this: both medications can cause central nervous system side effects. Central nervous system side effects include dizziness, drowsiness, sedation, impaired coordination, and confusion. These side effects can increase fall risk, especially in older adults. So, even though gabapentin and pregabalin are not opioids, nurses still need to monitor sedation and safety. Another important similarity is that both medications are cleared through the kidneys. That means kidney function matters. If a patient has decreased kidney function, the medication can build up in the body, increasing side effects. Pop test question: which organ is especially important for dosing gabapentin and pregabalin? A. Kidney. B. Appendix. C. Spleen. D. Gallbladder. The correct answer is A. Gabapentin and pregabalin are primarily eliminated through the kidneys, so renal function matters. Now let's talk about why patients may receive these medications. A common reason is diabetic neuropathy. Imagine a patient with long-term diabetes who says, "My feet burn at night, and sometimes it feels like pins and needles." That sounds like nerve pain. Pregabalin may be used for diabetic peripheral neuropathy, and gabapentin may also be used for nerve pain depending on the provider's plan. Another reason is postherpetic neuralgia. A patient had shingles 2 months ago. The rash is gone, but the area still burns and hurts when clothing touches the skin. That is nerve pain after shingles. Gabapentin or pregabalin may be used to help reduce that pain. Another reason is seizures. Gabapentin and pregabalin can be used as adjunct therapy for partial onset seizures. That means they may be added to other anti-seizure medications. Another reason is fibromyalgia, especially with pregabalin. Pregabalin is approved for fibromyalgia and may help with widespread pain in some patients. Now, these medications are sometimes used off-label for other conditions, such as certain types of chronic pain or anxiety-related symptoms, depending on the prescriber and patient situation. Off-label means the medication is being used for a purpose that is not specifically listed in the official FDA-approved indications, but the provider may decide it is appropriate based on evidence and clinical judgment. As a nurse, you do not need to decide the indication, but you do need to understand why the patient is taking it so you can assess if it is working and monitor for side effects. Pop test question: a patient says, "My shingles rash healed, but I still have burning nerve pain." Which medication might be prescribed for this type of pain? A. Gabapentin. B. Furosemide. C. Warfarin. D. Amoxicillin only. The correct answer is A. Gabapentin may be prescribed for postherpetic neuralgia, which is nerve pain after shingles. Now let's talk about common side effects. The most common side effects of gabapentin and pregabalin include dizziness and drowsiness. You may also see fatigue, confusion, blurred vision, impaired coordination, tremor, dry mouth, and swelling in the hands or feet. Swelling is also called peripheral edema. Weight gain can also occur, especially with pregabalin. Some patients may say they feel foggy, sleepy, unsteady, or not like themselves. These side effects matter because they increase fall risk. For example, an older adult starts gabapentin at night for nerve pain. The next morning, they feel dizzy when getting out of bed and fall. That is a safety concern. As nurses, we do not just ask, "Is the pain better?" We also ask, "Are you dizzy? Are you sleepy? Are you steady when walking? Have you fallen? Are you feeling confused?" Memory tip: gabapentinoids can make you groggy, dizzy, sleepy, and unsteady. Pop test question: which side effect is most important to teach patients about with gabapentin and pregabalin? A. Dizziness and drowsiness. B. Hair turning blue. C. Sudden height increase. D. permanent tooth growth. The correct answer is A. Dizziness and drowsiness are common and can increase fall risk. Now let's talk about serious safety concerns. One serious concern is respiratory depression. Respiratory depression means breathing becomes too slow or too shallow. Gabapentin and Pregabalin are not opioids, but they can increase the risk of serious breathing problems in certain patients. This risk is higher when they are combined with opioids, benzodiazepines, alcohol, sleep medications, muscle relaxants, or other central nervous system depressants. The risk is also higher in older adults and in patients with respiratory disease, such as COPD. So imagine a patient taking oxycodone for pain, alprazolam for anxiety, and gabapentin for nerve pain. That patient may be at higher risk for sedation and respiratory depression because all of those medications can depress the central nervous system. This is a major nursing safety point. Always review the medication list. Look for opioids, benzodiazepines, sedatives, alcohol use, and other medications that cause drowsiness. Also assess respiratory status when risk is present. Pop test question. Which combination increases concern for respiratory depression? A. Gabapentin plus oxycodone. B. Gabapentin plus water. C. Pregabalin plus a balanced meal. D. Pregabalin plus walking shoes. The correct answer is A. Gabapentin combined with an opioid like oxycodone can increase the risk of sedation and respiratory depression. Now let's talk about mood and mental health warnings. Gabapentin and Pregabalin are anti-seizure medications. Anti-seizure medications can increase the risk of suicidal thoughts or behavior in some patients. This does not mean every patient will experience this, but it does mean nurses should assess mood changes. Teach patients and families to report new or worsening depression, anxiety, agitation, panic attacks, irritability, unusual behavior changes, or thoughts of self-harm. This is especially important when starting therapy or changing the dose. As a nurse, you can ask in a calm and direct way. For example, since starting this medication, have you noticed any major changes in mood, depression, anxiety, or thoughts of harming yourself? It may feel uncomfortable at first, but asking directly is part of safe nursing care. Pop test question. Which symptom should be reported in a patient taking gabapentin or pregabalin? A. New suicidal thoughts. B. Mild thirst after exercise, only. C. Wanting a blanket. D. Feeling hungry before lunch. The correct answer is A. New suicidal thoughts or major mood changes should be reported immediately. Now let's discuss allergic reactions and hypersensitivity. Like many medications, gabapentin and pregabalin can cause allergic reactions. Signs of a serious allergic reaction include swelling of the face, lips, tongue, or throat, trouble breathing, hives, severe rash, or wheezing. Pregabalin can cause angioedema. Angioedema means deeper swelling under the skin, often involving the face, lips, tongue, or throat. This can become an airway emergency. Gabapentin has also been associated with serious hypersensitivity reactions, including drug reaction with eosinophilia and systemic symptoms, often called DRESS. You do not need to memorize every detail of DRESS as a beginner, but you should recognize warning signs. These may include rash, fever, swollen lymph nodes, and involvement of organs like the liver. So if a patient on gabapentin develops a rash with fever and swollen glands, that should not be ignored. Pop test question. A patient taking pregabalin reports swelling of the lips and trouble breathing. What should the nurse do? A. Treat it as a possible emergency and report immediately. B. Tell the patient to take the next dose. C. Document it as normal. D. Encourage the patient to exercise more. The correct answer is A. Facial or throat swelling with breathing trouble may indicate angioedema or a serious allergic reaction. Now let's talk about withdrawal and stopping the medication. Gabapentin and pregabalin should not usually be stopped suddenly unless the provider determines it is necessary. Stopping suddenly can cause withdrawal symptoms. It can also increase seizure risk in patients taking the medication for seizures. Withdrawal symptoms may include anxiety, insomnia, nausea, sweating, pain, irritability, and in some cases seizures. Pregabalin labeling recommends tapering gradually over at least 1 week when discontinuing. Gabapentin is also generally tapered rather than abruptly stopped, especially in patients with seizure disorders or long-term use. Patient teaching should be clear. Do not stop this medication suddenly without talking to your provider. Memory tip: do not ghost gabapentin. Do not suddenly disappear from the medication. Call the provider and taper safely if it needs to be stopped. Pop test question. A patient says, "My nerve pain is better, so I stopped pregabalin suddenly yesterday." What is the best nursing response? A. That is always safe. B. You should contact your provider because this medication is usually tapered. C. Take double the dose tomorrow. D. It only matters if you are taking antibiotics. The correct answer is B. Gabapentin and Pregabalin are usually tapered to reduce withdrawal symptoms and seizure risk. Now let's talk about black box warnings and major warnings. Gabapentin and Pregabalin do not have the same opioid-style boxed warning for addiction and respiratory depression, but they do have important warnings nurses must know. First, respiratory depression risk. The FDA warns that serious breathing problems can happen in patients using gabapentin or pregabalin who have respiratory risk factors, such as opioid use, other CNS depressants, COPD, or older age. Second, suicidal thoughts and behavior. As anti-seizure medications, they carry warnings about increased risk of suicidal thinking or behavior. Third, dizziness and somnolence. Somnolence means sleepiness. This increases fall risk and can impair driving or operating machinery. Fourth, hypersensitivity reactions. These include angioedema with pregabalin and serious allergic reactions with gabapentin. Fifth, withdrawal risk. Do not stop suddenly without provider guidance. Sixth, renal impairment. Both medications require dose adjustment when kidney function is decreased. So if you are looking for the nursing school safety cluster, remember breathing, mood, falls, allergy, tapering, and kidneys. Memory tip: gabapentinoids need BMFATK. B for breathing, M for mood, F for falls, A for allergy, T for taper, K for kidneys. Now let's talk about nursing responsibilities before giving gabapentin or pregabalin. First, verify the medication order. Check the medication name, dose, route, frequency, and indication. Gabapentin and pregabalin can be confused because they are similar, but they are not interchangeable dose for dose. Do not assume the doses are equivalent. Second, assess the reason the patient is taking it. Is it for nerve pain, seizures, fibromyalgia, postherpetic neuralgia, diabetic neuropathy? Knowing the reason helps you evaluate effectiveness. Third, assess pain quality. If the patient has nerve pain, ask if it is burning, shooting, tingling, numb, or electric-like. Ask what the pain level is and how it affects sleep, walking, and daily activities. Fourth, assess sedation and fall risk. Is the patient already sleepy, confused, dizzy, unsteady? Have they fallen recently? Fifth, assess respiratory risk. Does the patient have COPD, sleep apnea, low oxygen levels, advanced age, or current opioid use? Are they also taking benzodiazepines, muscle relaxants, alcohol, or sleeping pills? Sixth, assess kidney function. Look at creatinine, estimated glomerular filtration rate, or creatinine clearance if available. The provider and pharmacy use renal function to determine safe dosing. Seventh, assess mood and mental health. Ask about depression, anxiety, or suicidal thoughts, especially when starting therapy or increasing doses. Eighth, assess allergies. Ask about previous reactions to gabapentin, pregabalin, or similar medications. Pop test question. Before giving gabapentin to an older adult, which assessment is especially important? A. Sedation, fall risk, respiratory risk, and kidney function. B. Favorite color. C. Hair length. D. Preferred TV show. The correct answer is A. Gabapentin can cause sedation and dizziness, requires renal consideration, and may increase respiratory risk in vulnerable patients. Now let's talk about lab monitoring. There is no routine gabapentin level or pregabalin level that nurses commonly monitor in everyday practice. But labs still matter. The most important lab area is kidney function. Monitor creatinine, BUN, estimated glomerular filtration rate, and creatinine clearance when available. Why? Because gabapentin and pregabalin are cleared mostly by the kidneys. If kidney function is poor, the medication can accumulate and cause more side effects. These side effects may include severe dizziness, sedation, confusion, unsteady gait, and sometimes respiratory depression in high-risk patients. For patients on hemodialysis, dosing schedules may be different and may include post-dialysis dosing depending on the medication order. Do not guess dialysis dosing. Follow provider and pharmacy guidance. Other monitoring may depend on patient condition. If the patient has swelling or heart failure risk, monitor weight, edema, and symptoms like shortness of breath. If the patient has mood changes, monitor mental health and safety. If a serious hypersensitivity reaction is suspected, the provider may order labs such as CBC, liver function tests, kidney function tests, or other tests depending on the symptoms. But for beginner nursing pharmacology, the main lab message is, check renal function. POP test question. Which lab finding would make the nurse question whether a gabapentin dose needs review? A. Worsening kidney function. B. Normal oxygen level. C. Normal temperature. D. Normal appetite. The correct answer is A. Gabapentin dosing should be adjusted in renal impairment, so worsening kidney function matters. Now let's discuss administration tips. Gabapentin and pregabalin are usually given by mouth. They may be given with or without food. If the patient has nausea, taking them with food may help. Gabapentin has different formulations, and not all formulations are interchangeable. For example, some gabapentin products have special release patterns or dosing schedules, so do not substitute one gabapentin product for another unless pharmacy and provider instructions support it. This matters because different formulations may be absorbed differently. Gabapentin also has an interaction with aluminum and magnesium-containing antacids. These antacids can reduce gabapentin absorption. Patient teaching often says to separate gabapentin from these antacids by at least 2 hours. Examples of antacids may include products like Maalox or Mylanta. Pregabalin can be taken with or without food. For extended-release pregabalin, follow the specific product instructions. Some extended-release forms may need to be taken after an evening meal. Do not crush extended-release tablets unless the product instructions allow it. Always follow the exact formulation instructions. POP test question. A patient takes an aluminum magnesium antacid and gabapentin. What teaching is appropriate? A. Separate gabapentin from the antacid by at least 2 hours. B. Crush all gabapentin capsules. C. Take double gabapentin after the antacid. D. Stop all medications forever. The correct answer is A. Aluminum and magnesium antacids can reduce gabapentin absorption, so they should be separated. Now let's talk about patient teaching. Teach patients that gabapentin and pregabalin are often used for nerve pain. Explain that nerve pain can feel burning, tingling, shooting, or electric. Teach them that the medication may not work immediately. It may take time, and the dose may be adjusted gradually. Teach patients not to stop suddenly. They should talk to the provider before stopping because the medication may need to be tapered. Teach about dizziness and drowsiness. They should avoid driving, operating heavy machinery, or doing risky activities until they know how the medication affects them. Teach them to rise slowly from sitting or lying down. Teach them to use fall prevention strategies, especially older adults. For example, use nightlights, remove loose rugs, wear supportive shoes, and ask for help if feeling dizzy. Teach patients to avoid alcohol and be cautious with other sedating medications unless approved by the provider. Teach them to report slow or difficult breathing, extreme sleepiness, confusion, or inability to stay awake, especially if they are taking opioids or have lung disease. Teach them to report swelling of the hands, feet, face, lips, tongue, or throat. Teach them to report rash, fever, swollen glands, or trouble breathing. Teach them to report mood changes, depression, anxiety, unusual behavior, or suicidal thoughts. Teach patients with diabetes to continue foot care and glucose management. If pregabalin is used for diabetic neuropathy, it may help nerve pain, but it does not cure diabetes or reverse all nerve damage. Teach that pain relief does not mean they can ignore foot injuries. Patients with neuropathy may have decreased sensation and need to inspect their feet daily. POP test question. Which patient statement shows correct teaching? A. I should not stop gabapentin suddenly without talking to my provider. B. I can drink alcohol freely with pregabalin. C. If I feel dizzy, I should drive faster to get home. D. Pregabalin cures diabetes. The correct answer is A. Gabapentin and pregabalin are usually tapered, and patients should not stop suddenly without provider guidance. Now let's talk about what findings should be reported to the provider. Report severe dizziness, confusion, extreme sleepiness, or difficulty staying awake. Report slow, shallow, or difficult breathing. This is especially urgent if the patient is also taking opioids, benzodiazepines, alcohol, sleep medications, or has COPD or sleep apnea. Report falls or unsteady gait. Report swelling in the legs, feet, hands, or sudden weight gain. Report facial swelling, tongue swelling, throat swelling, wheezing, or trouble breathing. Those may indicate angioedema or a serious allergic reaction. Report rash with fever or swollen lymph nodes. That may suggest a serious hypersensitivity reaction. Report new or worsening depression, anxiety, suicidal thoughts, or unusual behavior changes. Report uncontrolled seizures or increased seizure activity. Report severe withdrawal symptoms if the medication was stopped suddenly. Report worsening kidney function or signs of toxicity in renal impairment. For example, if a patient with chronic kidney disease becomes very confused and sedated after gabapentin, the dose may need review. Report if the patient is taking multiple sedating medications. For example, gabapentin plus oxycodone plus lorazepam is a combination that needs careful monitoring. Pop test question. Which findings should be reported immediately in a patient taking pregabalin? A. Swelling of the tongue and difficulty breathing. B. Mild hunger before lunch. C. Wanting to watch TV. D. Normal urination. The correct answer is A. Tongue swelling and difficulty breathing can indicate angioedema or a serious allergic reaction. Now let's walk through a clinical scenario. You are caring for Mr. Williams, a 70-year-old patient with diabetic neuropathy. He is prescribed gabapentin. He also takes oxycodone after a recent surgery. When you assess him, he is very sleepy, difficult to keep awake, and his respiratory rate is 9. What should you think? You should be concerned about central nervous system depression and possible respiratory depression. Gabapentin plus opioids can increase the risk of serious breathing problems, especially in older adults. You should assess airway, breathing, oxygen saturation, level of consciousness, vital signs, and medication timing. You should follow facility protocol and notify the provider. Do not simply document that the patient is sleeping. Excessive sedation with slow respirations is a safety concern. Let's do another scenario. You are caring for Ms. Rivera, who has postherpetic neuralgia after shingles. She says, "This medication is making me dizzy, but my nerve pain is better." What should you do? First, assess the severity of dizziness. Is she at risk for falls? Is she confused? Can she walk safely? Check her blood pressure if appropriate. Review when the medication was started and whether the dose was recently increased. Teach her not to drive or get up quickly until she knows how it affects her. Implement fall precautions if she is in the hospital. Notify the provider if dizziness is severe, persistent, or unsafe. Pain relief is good, but safety still matters. Here is another scenario. A patient taking pregabalin says, "I stopped taking it suddenly 2 days ago because I felt better. Now I feel anxious, sweaty, and I cannot sleep." What should you think? This could be withdrawal or discontinuation symptoms. You should assess the patient, notify the provider, and teach that pregabalin and gabapentin should not usually be stopped suddenly. The provider may restart and taper the medication, or provide another plan depending on the situation. Now let's compare gabapentin and pregabalin with other pain medications. Acetaminophen helps with pain and fever, but not inflammation. NSAIDs help with pain, fever, and inflammation. Opioids help with moderate to severe pain, but can cause respiratory depression, sedation, constipation, dependence, and overdose. Gabapentin and Pregabalin are different. They are often used for nerve pain. They do not work well for every type of pain. For example, if a patient has acute appendicitis pain, gabapentin is not the main treatment. If a patient has inflammatory arthritis, an NSAID may be more directly anti-inflammatory. If a patient has burning diabetic nerve pain in the feet, pregabalin or gabapentin may be appropriate. So always match the medication to the type of pain. Memory tip: burning, shooting, tingling. Think nerves. And for nerve pain, gabapentin and pregabalin may appear in the treatment plan. Now let's review the nursing school must-know points. Gabapentin and pregabalin are gabapentinoids. They are commonly used for neuropathic pain and as adjunct therapy for seizures. Pregabalin is also used for fibromyalgia. They help calm overactive nerve signaling by affecting calcium channels in the nervous system. They are not opioids. They are not NSAIDs. They do not treat inflammation the way NSAIDs do. Common side effects include dizziness, drowsiness, fatigue, blurred vision, impaired coordination, and confusion. Pregabalin may cause peripheral edema and weight gain. Both medications can increase fall risk. Both medications require renal dosing consideration because they are cleared mainly through the kidneys. Major warnings include respiratory depression risk, especially with opioids or other CNS depressants, suicidal thoughts or behavior, serious allergic reactions, and withdrawal symptoms if stopped suddenly. Do not combine with alcohol or sedating medications unless approved by the provider. Monitor sedation, respiratory status, fall risk, kidney function, mood, edema, and pain response. Teach patients not to stop suddenly. Teach patients to avoid driving until they know how the medication affects them. Teach patients to report breathing problems, severe sleepiness, swelling, rash, mood changes, suicidal thoughts, and falls. Memory tip: gabapentinoids calm angry nerves, but watch grogginess, breathing, mood, and kidneys. Now let's finish with 5 true or false review questions. Question 1. True or false? Gabapentin and pregabalin are commonly used for neuropathic pain. The correct answer is true. Rationale: these medications help calm overactive nerve signaling and are often used for nerve pain such as diabetic neuropathy or postherpetic neuralgia. Question 2. True or false? Gabapentin and pregabalin are opioids. The correct answer is false. Rationale: gabapentin and pregabalin are not opioids. They are gabapentinoids and work differently from opioids like morphine, hydromorphone, and oxycodone. Question 3. True or false? Dizziness and drowsiness are important side effects because they can increase fall risk. The correct answer is true. Rationale: gabapentin and pregabalin can cause sedation, dizziness, impaired coordination, and confusion, especially in older adults, or when combined with other sedating medications. Question 4. True or false? Kidney function is important when dosing gabapentin and pregabalin. The correct answer is true. Rationale: both medications are primarily cleared through the kidneys, so reduced kidney function can cause medication buildup and increase side effects. Question 5. True or false? It is always safe to stop pregabalin suddenly once the pain improves. The correct answer is false. Rationale: pregabalin and gabapentin are usually tapered rather than stopped suddenly. Abrupt discontinuation can cause withdrawal symptoms and may increase seizure risk in patients taking them for seizures. And that is your beginner-friendly nursing pharmacology review of gabapentin and pregabalin. Remember, these medications are often used for nerve pain and seizures. Think burning, shooting, tingling pain. Think calming angry nerves, but also think safety, dizziness, drowsiness, falls, respiratory depression, risk with opioids, mood changes, allergic reactions, tapering, and kidney function. As a nurse, your job is to assess the type of pain, monitor for side effects, protect the patient from falls, check renal function, teach clearly, and report concerning findings early. Thank you for watching, and I'll see you in the next nursing pharmacology lesson.